7 shocking signs of prediabetes. Every woman should know. Prediabetes is a silent yet serious condition that often goes unnoticed until it progresses to type 2 diabetes. For women, the risks associated with prediabetes can extend beyond blood sugar issues to include complications such as hormonal imbalances and cardiovascular problems. Awareness of the early warning signs is crucial for prevention and effective management. Below are 7 surprising indicators of prediabetes that every woman should be aware of. Women often juggle numerous responsibilities, so occasional tiredness is easy to dismiss as a consequence of a busy lifestyle. However, persistent and unexplained fatigue could be an early sign of prediabetes. When the body begins to struggle with insulin resistance, it cannot effectively convert glucose into energy, leaving you feeling drained. Unlike the exhaustion caused by stress or lack of sleep, this fatigue lingers and doesn't improve with rest. One of the hallmark symptoms of prediabetes is an increased thirst, often accompanied by frequent trips to the bathroom. This occurs because excess sugar in the bloodstream pulls water from tissues, leaving you dehydrated. While thirst and urination can have various causes, such as increased water intake or hormonal fluctuations, they shouldn't be ignored if they persist or worsen over time. Prediabetes can lead to unexpected changes in weight, either gain or loss, depending on how your body is responding to insulin resistance. Weight gain often results from an increase in visceral fat that accumulates around internal organs due to metabolic dysfunction. Conversely, weight loss might occur because the body starts breaking down muscle and fat for energy when it cannot effectively use glucose. Both scenarios can signal a serious underlying issue requiring medical attention. One lesser-known symptom of prediabetes is the appearance of dark, velvety patches of skin, particularly around the neck, armpits, or groin. This condition, called acanthosis nigricans, is caused by high levels of insulin in the blood, which stimulate the growth of skin cells and melanin. Many women mistake these patches for dirt or irritation, delaying a proper diagnosis. For women, prediabetes can directly affect reproductive health. Insulin resistance often goes hand in hand with polycystic ovary syndrome, PCOS, a hormonal disorder that disrupts menstrual cycles and can lead to infertility. Irregular periods or an absence of menstruation altogether might be an early sign of underlying blood sugar problems. Have you ever felt ravenous shortly after finishing a meal? This phenomenon, known as polyphagia, is a common symptom of prediabetes. When your body becomes resistant to insulin, glucose cannot enter your cells effectively, leaving them starved for energy. In response, your brain signals you to eat more, even when you've already consumed enough calories. Persistent hunger can lead to overeating and further weight gain, perpetuating a vicious cycle. Tingling, numbness, or a pins and needles sensation in the extremities can be an alarming sign of prediabetes. This symptom occurs because elevated blood sugar levels begin to damage the nerves, a condition known as peripheral neuropathy. Although nerve damage is more commonly associated with advanced diabetes, it can begin during the pre-diabetic stage, particularly if blood sugar levels remain unchecked for a prolonged period. While these symptoms may seem unrelated, they often point to an underlying problem with blood sugar regulation. The earlier prediabetes is identified, the greater the chance of reversing it through lifestyle changes and medical intervention. Unfortunately, many women ignore these warning signs or attribute them to other causes, such as stress, aging, or hormonal shifts. If you're experiencing any of these symptoms, it's essential to consult a healthcare provider. They may recommend blood tests such as fasting glucose levels, HbA1c, or an oral glucose tolerance test to confirm or rule out prediabetes. For women diagnosed with prediabetes, lifestyle modifications can make a significant difference. Regular exercise, a balanced diet, stress management, and weight control are critical components of prevention. In some cases, medication may also be prescribed to help regulate blood sugar levels. This article is for informational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider for concerns about your health or before making any changes to your lifestyle or medication regimen. By staying informed and proactive, you can take control of your health and reduce your risk of developing type 2 diabetes. Don't ignore these potential warning signs. Your future self will thank you.